Good now afternoon. Thank you for your patience with all that was going on earlier. I realize I am in between us and a much deserved break and lunch. So I'll try to be as engaging as possible, but I definitely want to extend a deep amount of gratitude and appreciation and thanks to Pam, the entire ACAT staff. You guys are fantastic and so accommodating. I've been transitioning back from maternity leave, still transitioning, quite frankly, I think mentally, but while all this was going on in the prep, and the staff has been just so helpful. To all of you, tribal and community leaders, just want to also thank you for your incredible advocacy and your intense work, tireless work every day. I mean, as we all know, it takes more than a village, and I do believe we are going in the right direction, even though I agree it's slow and hard to digest it all. But I'd like to focus in on some work that the Children's Environmental Health Network is doing, and also some other very exciting initiatives and collaborations that are happening that, again, I think are breaking silos and really trying to address the magnitude of the many incredible challenges before us still. My name is Nse. Everyone calls me Nse, but my full name up here is Nsedu, Obot Witherspoon. My background is very multicultural. My father's Nigerian, so he named me. My name is Nigerian. It means expected virtue. And I also can very much relate to the connectivity and the need to be one with your tribe, your folks, your people, nature. So very much feel at home here on my first trip to Alaska. So. I also our office is in Washington, D.C. We are national as an organization, but it's imperative, especially during election year times, and then some, that I keep myself grounded. So I like to start talks and my day at times with different perspectives on children and the value of children, and these are just some of them. I'll read the one in the middle. There can be no keener revelation of a society's soul than the way in which it treats its children, and that's the late Nelson Mandela. So some of you may know about us. We are a national nonprofit, the Children's Environmental Health Network. We actually got our start out in the Oakland Bay area in California almost 25 years ago, 2017, believe it or not, will be our 25th anniversary. Unfortunately, I wish we were not in existence. I wish there was really no need for us, but there is very much still a need, but there has been progress. Our mission has always been the same from the very beginning, to make sure that all children have the right to a safe and healthy environment, and of course the families and those that support them getting the type of support and nurturing that they need to make those accommodations happen. Our goals to achieve that mission have always been the same, although we do it a little differently at times, but promoting the peer-reviewed research that you have just heard a little bit about here, and moving that into action in training, action in education and building awareness, to then eventually get to the harder parts, but the child protective policy work at the federal and the state levels. We're trying to identify these better opportunities, again, to break the silos. There's been a lot of great work happening in housing and pesticides and specific chemical areas, which is great, and even with specific subpopulations, wonderful. But we do need to find the ways pretty quickly, and there are many reasons why, as we've talked about all today so far, to connect and build our strengths together. We will see better returns in that way. So again, we've seen advances in our research, but we know, okay, there's always much more needed, but there is a lot to move on that we are not moving on. In complete agreement with that. A few policy successes, I would advocate that we've had more at the state levels. It's been frustrating at the federal level for many reasons. There are some federal policies, but I think it's honestly a disgrace that almost in 2017, we still really have no true child protective federal policy in the United States of America. But our states, generally speaking, are moving much quicker, and there's a lot of lessons learned there that I would hope that one benefit of this conference is connecting some of those dots. Some of us can be connecting some of you to other state leaders who are also grappling with some of the same challenges, and some that have had some successes and modeling some approaches there. This number really doesn't mean much. We know there's 85,000 plus. The point is we are inundated, as we know, with many synthetic chemicals due to the way that we do business and our dependency on chemicals in our marketplace and our economy. And we do know that our chemicals, generally speaking, are still not adequately considered and tested for their human impacts, and definitely the vulnerabilities of children. So the bottom line here is, as we know, children are still quite vulnerable, and it's up to us as responsible stewards and adults in their lives around them to do much better on their behalf. Ruth talked a lot already, I think well, about the early onset of illness. We're now dealing with more chronic illnesses, not as many infectious diseases as in the past. And many have noted that we are possibly living within the first generation that will see a shorter life than that of their parents and grandparents due to poor health. I mean, these are huge alarm bells ringing around us. Social determinants of health, this is just a graphic that I like to use. I like to look visually sometimes. If you put the child, and I would also offer the family cycle or that support network immediately around that child needs to succeed and thrive and have the nurturing that they need. Here are just a few of the very large factors that have many, many sub-factors underneath them that do impact the health and well-being of a child in a positive or negative way. We cannot work, again, in silos. We cannot just be working on one part of the quote-unquote health scenario without very much acknowledging all these other critical factors with each and every child and the families around them. So getting into some of the work that we've been doing, just a snapshot. In beginning of 2015, we held what's called a Wingspread Summit, the Johnson Family Foundation in Racine, Wisconsin. It's a pretty big deal where we made the case to them that we have an issue that needed discussion time in a very thoughtful, creative, beautiful space. It's amazing. So a group of visionary leaders came together, and we were focusing on, in this day and time, not 20, 25 years ago, but in this day and time, what are the true priority needs of the field? How do you wrangle an entire field of children's environmental health? As I just mentioned on the last slide or showed you, there's so many things. How do we make the impacts and make them well and prioritize? So we started the beginning stages of what ended up being a visionary statement, if you will, a proclamation. Many of our colleagues and friends here in this room and beyond were a part of that, which then also became the prelude to now the blueprint for protecting children's environmental health that I talk about in a minute. And we really were intentional. There's only 30-some seats in this setting of really bridging the gap between more non-traditional leaders that haven't really been a part of these discussions, urban planning leaders, a lot of legal perspectives, health economic folks, of course, community voices, just to name a few. So in this vision statement, and this is all online, and I'm happy to share other copies after, the gist is the general idea. I won't read it all, but this real proclamation, and it took a while. I really didn't expect that we were going to leave with this consensus, but there were folks that worked almost through the night to make sure that the 30-some folks that came together that day did have a unanimous feeling that this is the rally cry that we all need to be working under. I don't think there's anything in there that anyone would disagree about, but we needed to kind of have that moment that we all could agree upon so that we could then move forward as a field. Here are the critical aspects that are identified as threads. Mobilizing greater societal understanding of children's environmental health. I mean, I'm still boggled. I was at the Hill briefing speaking with Maureen, and when we go to the Hill and do Hill visits, we call it, and we bring the science and the education, I'm still amazed, I guess, with how many of our elected leaders have no clue of some of the issues that you all are hearing about today. No clue, even around asthma, for some basics, or lead poisoning. We still have a long way to go, I think, in some of our education of some basic folks that do have quite an amount of influence. Creating knowledge essential for action and using that knowledge that we have now, which we've been talking about. Marshaling the engine of the economy. I would advocate that we've been doing ourselves a disservice in public health. We do what we do very well. But when we get into the other side of the coin, right, where there's people that for some reason, what we've talked about isn't enough to motivate them to do good, when you start talking dollars and cents, then they really start to listen. We have that story. Increasingly, we now have that story that it is not only a health, economic, and moral and ethical perspective that we're promoting here, but there are many cost benefits that are now being tagged that we can add to our advocacy pieces as we're all out there doing our work. And then building the political will within our government institutions and beyond for child-centered protective policies. So here's what the blueprint looks like. Again, really focusing in on connecting the social determinants of health and justice and equity are really threaded throughout. We also support research by putting on pediatric research conferences every couple of years. We're a smaller national nonprofit. We could never do it every year, but I'm pretty proud of the fact that it's an opportunity to offer emerging science, especially not only for senior researchers, but for junior researchers coming along the journey here, and also the translation of that science into proactive public health action and protective policies, when that can be encouraged. We really do encourage all the speakers to think along that realm. So there's a little something for everyone. And the next one is going to be in DC in the coming April 5 through 7, 2017. So if you can attend, we'd love to have you. And there's a call for abstracts and session proposal abstracts out there now. And we would encourage you letting your colleagues know as well. This is my 6-month-old that will be joining us for the reception later tonight, one of 4. But in other ways, we have a science committee. So we are governed by a board of directors, but we do have advisory committees that help ground us, and they're our sounding board. They're extremely helpful for us as a smaller national nonprofit. The Science Committee is made up of all different government and non-government advocates who we very much respect and need to turn to for guidance and prioritizing in many cases. We offer an article of the month, so we try to take any of the peer-reviewed science once a month and drill it into a user-friendly, what does this mean to me at the end of the day? How can I apply this, bench science into my work that I'm doing in my community? It's now been running for 8 years, and it's still one of the most asked about resources online and for our organization, so we won't be getting rid of it anytime soon. We do actually get involved in publications ourselves now, which is pretty exciting. The last 3 years, we've actually been part of peer-reviewed publications and have another one coming out before the end of the year related to the blueprint, which we're excited about. We serve on a variety of advisory science councils, so that is quite an experiment at times, and experience, but it's very important for us to be that child health voice at some of the scientific tables that are determining where money is going and how research dollars are being spent. Here are just some of the boards and councils that I'm currently on. We have on education and training. We have an education committee, again, made of a great amount of additional advocates. I'm a firm believer on a community aspect of doing the work that we do. We have this research tool for healthcare professionals. We actually got our start out training nurses and doctors in the late 80s and into the early 90s. As Ruth mentioned, they weren't really being trained, still are not systematically, I'd say nurses more than docs, being trained in a regular way in all of our schools, nursing and medical schools, on environmental health, but we're getting there thanks to many champions like Ruth and many others. We have we had one of the first training resource curriculums out there for healthcare professionals. We revamped it a year or so ago. It's 12 topical modules, and there's also a user guide. So it's being used for teaching, and it's also being used for information and learning and building awareness. We have all kinds of fact sheets currently translated in English and Spanish, and hope to get to other languages, available for free on our website. And we're launching just next week, Children's Environmental Health Day. This is a day, it's supposed to be a platform, so it's on the frame of this blueprint for protecting children's environmental health, that there's something for every single one of us to do to protect kids. And as I mentioned those themes before, it's under that umbrella. But it's really also a way for us all to take a step back and recognize that there's always more than enough to do. There's probably never enough resources and people to get it all done, but we should be identifying this, taking a moment to celebrate the successes that we have had, the successes of joining together, collaborating effectively, which is very hard to do at times, and more importantly, building our momentum for what the next frontier should be. So again, even though you can't be, there's a DC event happening, but there's a lot of social media activity. We want to let the media be blasted about putting children first, putting families first. And then every October, which is Child Health Month moving forward, the second Thursday of every month will now be deemed Children's Environmental Health Day. So it's also an opportunity to release new tools and resources for the field. And we're encouraging, it's not just for the Children's Environmental Health Network, it's for the field of children's environmental health. And again, we have many of our partners here and beyond that have been great in supporting, and we encourage you all to be a part of that. We also run the EcoHealthy Childcare program. Pretty proud of this program. It's been running for 10 years now, even since its pilot stages. It's the only program nationally in the country that's working to train and educate healthcare professionals, owners, facility managers on basic environmental health practices. And we focus on low to no cost steps. We're not going to go and tell you to, totally fix your leaky roof. Your basic child care standards should be addressing that. We're trying to fill in the gaps where current child care standards are not addressing. And there's no formal mandate in any state right now looking at environmental health measures, unfortunately, but we're slowly getting there. This program is also working with child care licensing and accreditation, so that down the road, as states look at their child care policies, they are starting to consider the environmental components that should be added in a regular way. We also train, so there's a whole train the trainer program function of this. And I know we were in Alaska. Our wonderful trainer, the late Carol Strobel, came in a few years ago and did some great trainings in Alaska. So I know that we are here in the state, and if there's any way I can connect you to some of the providers and trainers, I'm happy to do that. And we will have an online curriculum that's coming out on this that will also allow us to reach much further than having trainers go out state to state. And then again, working on child protective policy. So at the federal level, there is what's called the Toxic Substances Control Act, and that's a dissertation in itself with the time that we have. But pretty much this was intended to be one of our most influential environmental health laws that should have been very protective for us. It was supposed to look at the way that we evaluate for health and concern the type of chemicals that are allowed in our marketplace and in our products that we all buy on a regular basis. Unfortunately, it was quickly found out that that was not happening, and it was clear that EPA was not given the authority under this law to really do the work that they had to do. So 40 years into this has been a failed law, unfortunately, but thankfully this last June, a bipartisan bill was passed to reform this bill. We're currently in the process of the rulemaking steps that will then start to be enacted by next summer. It's usually a year from when it's first passed. So it's a very exciting time. A lot of us are working in the public health side to make sure that we're not remiss on the vulnerabilities of children and many others as those rules are being developed. So it's a very critical time for us. And many groups have been working for years on this type of reform. So I would consider that a win. It's never perfect, but I would consider that a win. In clean water, we're working on lead service line replacement collaboratives that have water municipalities with public health agencies, with environmental health agencies. It's pretty exciting. Of course, Flint, the water crisis is one of many. We will see many of these emerging as long as our current water infrastructure is as old as it is. So that just has to change. We can't deal with that anymore. When we're talking about clean air and climate change, we're working with the American Lung Association, a wide variety of other groups like the American Public Health Association and many others on healthy air partners. So we look for when are there opportunities as far as bills that are being introduced when again, we can all insert and be a part of the messaging, public health, prevention, children's vulnerabilities, reproductive vulnerabilities. These are all aspects that we're always trying to look for when our federal legislation is coming down the pike. And many of us were a part of Zika Health Coalition, which just secured some funding finally last week or a few days ago. And that's been a long time coming as well. The fact that pesticides were used a lot in Florida, Puerto Rico, and many other places. And what are the ramifications of that down the road, in addition to the virus itself? So lots to consider there. There are no national standards that exist for assuring that a child care facility is not located on a site that could have been used previously with very harmful chemicals. That's quite unfortunate. There are a few states, only New York and New Jersey, that do have regulations of siting of child care facilities. And unfortunately, like is typical in this country, it's because there was a very awful example in New Jersey, a kiddie college that a lot of kids were getting sick. It's a little child care facility, and come to find out that that land was used as an old mercury plant. These are the type of things that we cannot keep doing. And I know you all know about bad experiences where we don't seem to learn our lesson and make the same mistakes again and again. I'm very excited to announce that next week, as part of Children's Environmental Health Day, the CDC ATSDR is going to be releasing a whole new set of national guidelines for national child care that many of us were a part of. It's not mandated, but it's hopefully getting us closer to some of these type of standards that we critically need to protect children. And we also work with the Environmental Law Institute, so I'm trying to share some of the collaborations here on a report that looked at environmental health policies in states across the country, and how can we overlap that with opportunities in the child care arena, in the early learning, and maybe even the K through 12 arenas. There are some states that do a lot better with child protective policies and then regulation of them, and how do we take that leadership and that momentum and apply it in other policy settings where kids spend a lot of time. I won't go into all of this, but in we also work on health in all policies through a CDC cooperative agreement that's just ending this month. And all kinds of who's in the child care arena, the Association of Early Learning Leaders, the National Association for Regulatory Administrators, and the National Resource Center for Health and Safety in Childcare. All of them have not only been a part of our advisory groups, but they've been actively working, looking at how can we either create or strengthen current environmental health standards. And these are the who's who of who's setting standard setting in childcare, and they're considered the gold standard. So it's very exciting to see them learn and then share within their board of directors and their leadership where they should be going as leaders in the field of childcare. There are also some states that are making good strides here. I won't go into all of that, but Pennsylvania, Vermont, New York, California, Minnesota, on and on. Not only are there many states that have been proactive on chemical bans in some of the products, especially in products that are marketed for children and young people, but also looking further at child care initiatives and how they can train child care providers on some of these very important issues instead of waiting for kids to get very sick. I believe this is my final slide. This is a whole list of additional collaborations and partnership. We're all about collaborating. We know we can never do this by ourselves. We won't be even halfway as effective. The Cancer-Free Economy Network, there are many of our colleagues here. This is an effort that's looking at a North Star goal of, in one generation, making sure that the conversation and efforts around cancer in this country are not focused just on treatment, that are also acknowledging the science available that do lead us towards some preventive aspects, and that is actually part of our active discussion and work. Again, lead service line replacement work, radon work at the national level, Project Tender, as Maureen mentioned, Healthy Babies, Bright Futures, which Charlotte Brody will talk about later. There's an herbicides collaborative we're a part of, where there's a lot of increased projections of using more herbicides in our Midwest instead of less. So again, we still have a lot of work to do on basic education and needs here. There is climate change work, and there are national environmental health public partners that come together and really try to think of, again, how are some lessons learned in certain parts of the country that can be applied to other parts of the country, and of course, in union with our communities and the community leadership and listening to the communities, as we've heard about earlier today. This is my tribe at home, except for the little one. I have 4 little ones, not so little. The oldest is 13 now, but here's my contact information. I really, really do appreciate the invitation to be here with you today.